Hi, everyone. Good afternoon. Thank you so much for being here today with O'Connell's. My name is Jen Grassi. I'm the Director of HR here at O'Connell Care. My teammate, Mike Hanek, he's going to be here with me also, but we're practicing social distancing and keeping a safe 6-foot distance between the two of us and trying to practice what the CDC and the media and everyone is saying about keeping a distance from each other while we're here at work. So him and I are going to jump in and out and give you some information today surrounding COVID-19. There's Mike. Say hello. So if you're keeping up with the news, which I'm sure many of you are, of course, this is an evolving situation for the country. This is an unprecedented time for us as we all try to maneuver through the new information surrounding COVID-19 and how we're all going to cope with it and move forward as a company, as a country, and how we're going to do it together. And so Mike and I are going to talk today just about some general information surrounding COVID-19 and what we expect our employees to practice while you guys are still out in the field, taking care of our clients and doing the most valuable job we can imagine right now, taking care of the elderly in our communities. So a really big thank you to you guys for stepping up and coming into work every day and being on the front lines, protecting our most vulnerable population. Myself, Mike, Danielle, and our leadership team, we really appreciate you guys. You've been such good sports, and I think I can speak for all of us when I say we so value every single thing you guys bring to O'Connell's and the passion that you have for keeping your clients safe. So thank you. Okay, today we are going to go over, like I said, the new and evolving information surrounding the coronavirus, which is also known as COVID-19. And this is new information. It's an evolving cycle of news every single day, and I feel like we're doing a really good job here at O'Connell's at staying on top of it. But in the essence of not seeing you guys every day like we normally would, we really wanted to create a channel to still stay connected to you guys, help you develop in your roles, keep you informed about all the news. So we're going to continue to do these Facebook Lives over the next few weeks to help you guys obtain your certification credits and also stay in the know about everything that's going on about the coronavirus and how we are handling here at O'Connell Care. So for those of you who are curious about the strain of COVID-19 that's come about over the last few weeks, this is an infectious disease, is what the CDC is saying. It's a very infectious disease that's forming in the form of a virus. So the science behind the coronavirus is not what I'm here to go into today. I'm going to talk about the symptoms, how it spreads, what you should do if you feel like you have come in contact with the virus for yourself or some other form of a contact. And then we're going to how to keep your own self safe at your home as well as safe the client's home. I'm sorry for the noise. I was getting a call. So I'm going to start with symptoms. You've probably heard this a million times already, but just to reiterate, the symptoms of corona are fever, cough, and anything respiratory. So difficulty breathing, shortness of breath, pressure on your respiratory system. If you or anyone you know start to have symptoms in that regard, you definitely want to reach out to a healthcare provider and pay attention to what's going on in your body. How it's spread is the biggest news in the world today because this is a very contagious virus. And right now, the goal is to flatten the curve and contain the virus from spreading. It's already here. It's infected in some people. And so in order to curb the spread and to stop it from infecting more and more people, we all need to do our part in containing the spread, practicing social distancing, and being very diligent of ourselves and the people who are the most at risk. So I'm going to talk today now about how the virus is spread. And there's really two main ways. One is person-to-person contact. So this is how it's thought to mainly spread in the vast form, is when you come into close contact with someone who has either sneezed or coughed. So what happens is when someone sneezes or coughs, they shed a respiratory droplet that, when inhaled, can infect someone with the virus. So in the essence of practicing social distancing, that's been really effective when you keep your boundaries with someone so that those respiratory droplets don't make their way into your lungs and infect you with the virus. So standing 6 feet away from someone, covering your nose, covering your mouth when you cough, and being really diligent about how you clean up your space and your hands around you when you have had a respiratory droplet is really important to controlling the spread. What happens is it gets into the system and it infects the lungs, and that's when we have to be really careful about our vulnerable population. So anyone over the age of 60 is really at risk, and anyone who has a suppressed autoimmune system is also at risk. The other way that it's spread is contact with infected surfaces. Mike's going to go into a little bit later on about how to keep those surfaces clean. But even if you're not in personal close-to-close contact with someone who sneezes or coughs, you can still get it because those respiratory droplets live on surfaces for up to 24 hours. So if a person who was infected did sneeze or cough and you went and touched that surface that wasn't disinfected, there's a pretty good likelihood that you could come into contact with the virus in that way as well. So pay close attention to yourself and the people around you, especially if people start to become symptomatic. You want to make sure you call your healthcare provider and you start to take the necessary hygiene and cleanliness steps to stop the spread if you see it starting around you. To prevent yourself from getting sick. So hopefully everyone is doing okay and we're all really healthy right now and staying far away from the virus and anyone who is infected. But if you do start to feel like you're coming into contact with people who are getting sick, or for whatever reason you're taking those necessary precautions because you feel like you're a little more exposed in your personal situation than other people, here are a few things that you can do to prevent yourself from getting sick. And that's washing your hands thoroughly. Every time you wash your hands, you want to try and wash them for 20 minutes with soap and water. You can use alcohol-based hand sanitizers, and I know that there's a shortage of them right now around the country. You can use those if you can't run to the bathroom every 10 minutes that you want to wash your hands. But washing with soap and water is still the most effective way to keep your hands clean. You want to avoid touching your eyes and your mouth, especially if you are still working and you're in contact with people and surfaces. Please be really careful about touching your face and your eyes, because if those germs and the virus are living on surfaces and you're touching the surfaces and then touching your face and your eyes and your mouth, then that's another way that you can transmit the virus. You want to avoid close contact with anyone who is sick. And this doesn't mean that they're just sick with the virus. Anyone who is sick in general with a sore throat or an ear infection, any type of illness related or unrelated to the coronavirus is something you really want to be cautious about and distance yourself, especially if you're in the field and you're still working. So be really cognizant of that. If there's someone in your house who is sick, please try and isolate yourself from them and keep a really safe distance so that you don't come down with any types of symptoms. You also want to avoid crowded places. This is pretty easy right now because obviously Massachusetts has mandated stipulation where people can't congregate in large crowds. So we're not going to restaurants and bars. We're not going to concerts right now. We're not gathering at anything social under 25 people. So it's pretty hard to find a crowd these days, but if you do find yourself congregating into a mass group of people, you really want to try to avoid that situation because this is a very contagious disease and it can spread quickly. So at all costs, please try to avoid that. Stay 6 feet away from everyone. And keeping your immune system strong is probably one of the most important things of all to keep yourself protected from getting sick. This really affects the immune system if you get the virus. So Getting enough rest, eating a healthy, balanced diet, and trying to exercise every day could really help you in your fight if you do contract the virus. Your immune system in general has antibiotics to help you fight certain viruses, but this is a new virus, and there's still a lot of questions around how our system is going to react to it, even when we're not immune, even if we're not having like an immune suppressant. So just be really cognizant in what you can do in your day-to-day to help fight the virus. Getting 8 hours of sleep, eating fruits and vegetables, and trying to get outside for a brisk walk or a 20-minute workout. Those small things every day could really help you fight against the virus. So we're going to jump now and talk about a couple what-if scenarios. So you know and understand the virus by now. You're probably aware of the signs and symptoms when they come up between yourselves, your family members, and your clients. So what to do when you come down with symptoms or your client comes down with symptoms. That's what we're going to talk about here today. And before I jump in, just a quick housekeeping note. For anyone who's watching today or is going to watch this later on our YouTube channel, in order for you guys to get the in-service credit, we'll need you to leave your name in the comment section on the video. So everyone who's taking the time to be here today, of course, we want to reward you with getting an in-service credit for this training. So please just put your name on the right-hand side. There's a comment section, and just leave your name here so that we know that you're here. After the live stream goes offline, we're not going to be able to see who was attending the video. So it's important that you just leave a note that you were here. Okay, so jumping ahead to some what if scenarios. So if you all of a sudden start to come down with these symptoms, today you're feeling pretty good, but tomorrow you wake up with a dry or watery cough and you're not sure what to do, the first thing you're going to want to try to do is to reach out to your doctor, call your PCP. Don't show up at the emergency room or the urgent care. The CDC is really trying to keep people out of those facilities and do a lot of work over telephone or video. So please reach out to your doctor first, inform them of your symptoms, and they will give you the direct next steps of what you should do. If you're having trouble reaching your doctor or getting an appointment to see your doctor when you're symptomatic, there is a helpline that the CDC has set up in the past couple of days. And the number for that is 211. So call the hotline. There are people ready to help to direct you to next steps if you do feel like you're symptomatic. Or if you just have some general questions about COVID-19, they'll be able to answer those for you as well. Also, we would really like for you to call O'Connell's immediately after you've talked to your doctor and taken those necessary steps to inform someone of your symptoms. We as an agency would really like to know how at risk you are, or where you've been, or potentially who you could have exposed. So it's important to remember to call us if you're taking that step where you feel like you need to call your doctor because of the symptoms that you've come down with. If you've come into contact with someone who has found to be positive for corona, the likelihood of you needing to self-quarantine when you're in direct contact with someone is pretty high. Right now, they're saying a 14-day self-quarantine for anyone who was directly contacted by someone who was and has tested positive. We've been hearing that the CDC or the local health providers are going to reach out to anyone who was, in fact, in contact with a positive corona test. But just keep in mind and be prepared that if you find out before you hear from the CDC, you should start to self-quarantine and continue to self-quarantine for 14 days. But again, you will be contacted. We know that that's sort of the process that they're going through right now, is asking anyone who has tested positive who they've been around. And then the CDC and their partners with the health organizations are doing the groundwork to reach out to anyone who was infected. We're getting a lot of questions about being in contact with someone who was in contact with someone who was symptomatic or confirmed with coronavirus. Right now, there's no clear evidence that you should panic or jump into hysteria because you know someone who knows someone that was infected. Contacts of contacts, from what we understand from the CDC, they are essentially saying that we aren't at risk unless we've been directly in contact with someone who was positive. So don't panic if you know someone who knows someone. There's no evidence right now that just because you were in contact with someone who was in contact with someone who was later found to be symptomatic, that you're going to contract the virus that way. So just remain calm, watch yourself, and monitor for any symptoms. And if you do start to become symptomatic, that's when you'll want to reach out to your doctor. But please, right now, we want to be very clear with that. There's no evidence suggesting that you could potentially contract the virus if you weren't in direct contact with someone who's either symptomatic or tested positive. I'm going to move on to talk a little bit about our expectations when it comes to being cognizant of your clients and their changes in behavior and any symptoms that come up on a day-to-day with them. So as diligent as you guys are in the field, we know and we feel really confident that you're going to be able to judge when your clients come down with these types of COVID-19 symptoms. Fever, shortness of breath, cough, any type of respiratory struggle. That is when you'll want to jump on the phone and call O'Connell's nursing team to walk them through the symptoms that you're experiencing with your client. And then with the direction of the nursing team, you're definitely going to want to reach out to the client's doctor. So those are the steps that we're asking you guys to take, is to keep us informed of your client's decisions and then also reach out to their healthcare provider or inform them to reach out to their healthcare provider. Our nursing team will follow up with them, we'll keep in touch with them, and we'll make sure that everyone in the home is staying safe regardless of how that appointment pans out with your client. So I'm going to jump out and have Mike come in, and he's going to pick up on some sanitary requirements. And he's going to talk a little bit also about protective equipment, because I know that that's a big cause of concern in the world and on the media today. So I'm going to hand it over to him, and he's going to wrap it up. But I just want to end before I hand it over to Mike with that we totally understand the uncertainty and the concern that's out there today with the coronavirus. We feel it too. And we certainly want to make sure that while we're here and we're working every day, that we are a resource for you guys. We might not know it all, but we will get the answers for you if you send things our way. We definitely want to make sure you guys know that we're open and we're here every day and we're ready to battle through this virus with you guys. So please don't hesitate to pick up the phone and call the office or call Mike and I directly. We are in constant contact with the CDC and all the surrounding health organizations in Massachusetts to keep you guys up to date and follow proper precautions on COVID-19. So thank you for your patience with us. You guys have been incredible over these last couple of days as new news has been evolving in the community. And we just want to say thank you so much for your patience and your calmness during this time. So I'm going to hand it over to Mike, and he's going to pick it up for the next couple of minutes. Thanks, guys.
How's it going, everyone? My name is Mike Heineck. I am the new HR generalist here at O'Connell. I'm very excited to get started and get to know you guys and work with you guys. And hopefully, as things settle down in these very uncertain and insane times, that I'll be able to reach out to you guys and have more uplifting and positive trainings and messages for the team. But right now, we are dealing with a very serious situation with COVID-19. And we here at O'Connell really want to make sure that you guys are absolutely prepared with the equipment that you need to be able to better protect yourself and our clients. So we're going to go over our personal protective equipment and hand washing. Currently, we are really recommending that gloves are used in every situation when coming in contact with the client and their homes and when it comes to cleaning. Now, gloves, as you may know, and with masks are in very high demand right now, particularly in the healthcare field. This is a very fluid situation. We here are really committed and driven to give you guys the equipment that you need. But as you guys should know, this is a very fluid situation. Supplies is not necessarily guaranteed, but for right now, we are guaranteeing that we could be able to give you the personal protective equipment that you need to keep yourself and your clients safe. Now with gloves, gloves are a huge point of contact when it comes to dealing with viruses and contact and droplet precaution in particular. Now, when you have your gloves on, you want to be aware that do not keep your gloves on for the entirety when you are working with your client. This is the same surfaces as you would just have your hands anyway. What you want to do is for every instance and situation where you're in contact with the client or cleaning these surfaces that I'm going to get into in a second, or high touch area surfaces, you want to replace your gloves after every single contact and use. So put your gloves on, do what you need to do to keep the client safe and everything. And then when you are done, safely remove your gloves. Now, do not just grab your gloves and throw them anywhere. What we want you to do is safely remove one glove, like so, and untuck and roll in and dispose. The next one, what we want you to do is slide your fingers, 2 fingers in underneath the glove. Please do not come into contact with the surface of the glove, because then it will become a contact with your hands. And again, slide it up and roll in. And then please properly dispose of your gloves after use. Now, when it comes to hand washing, we also really encourage you guys to wash your hands as often as possible in every single situation. A very good rule of thumb is wash your hands, lather, sing happy birthday twice, for approximately 20 seconds, getting in your crevices, getting into your fingers here, obviously getting your thumbs, and making sure that your hands are as disinfected and clean as humanly possible. And then also using hand sanitizer. I know hand sanitizer as it stands right now is not available as humanly as possible. However, when you are using hand sanitizer, please make sure one pump, and to get it to work properly, rub it in until your hands are completely and absolutely dry, thus ensuring that we have disinfected our hands. Now, masks. The CDC has given us some guidelines on how to properly use and when to use masks. So when you should wear a mask, and there's 2 defined ways that you should be wearing a mask. If you are a healthcare worker caring for someone with symptoms of COVID-19. Now, if you are working with a client and they have one of those 3 symptoms, a dry cough, a fever, or, dry cough, fever, what's the third symptom? Shortness of breath. I'm sorry, I apologize. So dry cough, fever, or shortness of breath. If you are dealing with a client that has any of those 3 symptoms, you're going to want to be wearing a mask when dealing with, any interaction with this client. Or if you have one of those 3 symptoms that I just said, you personally have one of those, you're going to be wanting to wear a mask. Now, the only situation where you'll be in a client home and working is if they have symptoms. If you have symptoms, remember, please isolate yourself. Please get in contact with your healthcare provider and with O'Connell, and then we will be giving you further instruction from there. Please do not wear a mask out in public. In public, it is not recommended that will keep you safe from contracting or being in contact with the virus. You actually put more people at risk, and you also waste a valuable medical equipment needed to keep our public safe. Now, again, at O'Connell, we are very committed to getting you the equipment you need. Please feel free to call the offices, see what equipment we have, and to keep you safe and the client safe. And we really, really, really want to enforce that. Please be diligent in how you use this equipment. It's a very fluid situation, but we want to make sure that you are using your resources responsibly and effectively. Now, we're going to get into high touch surfaces now when you're in the client home and how to properly disinfect them. Now, high touch surfaces, Please always wear your disposable gloves when cleaning these surfaces and dispose of them after cleaning these surfaces. These surfaces are, you know, are surfaces that are constantly touched by yourself and the client or anybody coming in and out of the home. You know, these surfaces are tables, light switches, and then also commonly used facilities like the toilet, the sink, anything that you and your client are in contact with on a very consistent basis. Please be sure to clean these as much as possible and make sure that you are properly using your disinfectant, whether that's bleach wipes or anything that is certified to kill and clear viruses and disinfect surfaces. Please be sure to properly apply that to the entire surface, wipe it down, and properly wipe it off, ensuring that we are keeping our clients and ourselves safe from coming in contact with any type of virus or situation that could be going on. Now, when it comes to high touch surfaces, it is different and varies per home. You know your client's home and you know the situation in which you're in. Please be diligent and aware of where people are touching, where people are moving about the home, and where people are walking about the home, so that you can better understand your situation and where to clean properly. And then finally, as we have more and more information about things coming in and out of the home, we really want to implore people, if you're taking in packages, boxes, or anything coming in from the outside world, that these items are taken care of properly and effectively. If a box comes in, please make sure that you are putting it on, say an Amazon package comes in. We want to make sure that you are taking it in, putting it on a surface like a towel or a table that can be cleaned off afterwards, and that you are properly wearing gloves, removing the items from the package, disposing of the package, properly disposing of your gloves, and disinfecting the surfaces that the package touched. These, as people become more and more self-isolated, one of the very few things that can come into contact with people's homes is these outside packages. So please make sure that you are doing everything that you can to disinfect where these packages are, to dispose of the packages properly, and then dispose of your PPE that you used to handle such packages, because we don't want something coming in from Amazon or the post office that could potentially affect your health and the client's health. And then finally, in these very trying times, me and Jen were talking about how we really want to let people know that we really do appreciate you guys. We appreciate and understand how very difficult it is to go into these situations, knowing that you still come to work every day with the client's needs in mind, with the client's health in mind, and you guys are on the front lines battling this crisis, and we really do appreciate that. We understand it is very difficult to go home and not know what your day-to-day new life is going to be. Our day-to-day lives are changing, unfortunately, and we are hoping that it is only for the interim. But for now, in terms of coping with the COVID-19 crisis, we wanted to just let you know of a couple of things that are still available to you, and then some things that you can do while you're staying self-isolated and social distancing, so that you can, your mental health and you guys are absolutely okay in your home, and knowing that you guys can stay safe and still have, things to do and encounter with your families, and be able to stay sane, because these are insane times, unfortunately. So, we just want to let you guys know. I mean, as it stands right now in Massachusetts, restaurants are still doing takeout. So please feel free, instead of, taking a night off from cooking, go get takeout from your local restaurant. Support your local restaurants and your local businesses as much as you can. And that will allow you guys to, have a family dinner and have that type of interaction that you almost get in a restaurant. Please go outdoors. Outdoors is a great way to stay the recommended 6 feet away from people, but still getting out of your homes and going to experience, the great wide world of nature that we have. Hiking, walking, biking, all those things are still totally okay. And if you go outside and, you are able to hopefully free your mind and be able to, get out of their home. And this is a way that you can also, get your children out of the home and just be able to go experience something that's not within the confines of what you're dealing with. Please use social media, Facebook, Twitter, Instagram, any modes you have social media. Please use those methods to be able to keep in contact with people that you have. Keep in contact with friends and family using not even social media, but just your FaceTime and stuff like that. It's very important that you call and check in on relatives and friends in these tough times, and having that type of emotional and human connection can go a long way in keeping everybody sane and safe. Try to keep routines in your home. I mean, your normal routine on a day-to-day outside the home has absolutely changed, but keep routines in your home. Cook, clean, have situations, if you have children, still try to do the best you can to have activities for them, break out the board games, break out the coloring books, do things like that to establish a routine. If you're able to do, self workouts at home, that can go a long way in, keeping active and engaged. And then, I'll say stay active. Stay active is incredibly important. Keeping things, keeping your mind running and going, that is incredibly important in, keeping a sane and calm demeanor in these trying times. And people really don't necessarily like being cooped up in the house. And, unfortunately, this is something that we are all in together. We are all hopefully going to get through together. And it's incredibly important that, we support one another and we are here for one another. Social distancing does not necessarily mean, cutting yourself off from the entire world. It means that we have to stay a safe amount or distance away from each other so that we can keep each other safe. However, we want to keep each other still interconnected and still, intertwined with our daily lives so that we may all band through this together and come out the other end. So hopefully this live stream was very helpful for you guys. Again, this is an incredibly fluid situation. Things are changing daily, hourly. We are doing our best, and hopefully we are able to give you the information that we receive in the same timely manner as fast as possible. We want to keep you guys as informed as possible when we are informed. So please feel free, again, call the offices, call Jen or I. We are more than willing and happy to keep you guys informed to the best that we are. If you guys have any questions at all about, personal protective equipment, gloves, masks, sanitizers, call the office. We'll be happy to tell you, where we're at with the levels of our supply. And we just know that we are doing our best to keep the supply levels running and humming and everything that you guys need to stay safe. And safety is incredibly important. And as Jen said earlier, symptoms, if you're experiencing symptoms, if you're experiencing any disease or that you feel that is affecting you, please be in contact with us and please be in contact with your healthcare professionals as much as possible. It's incredibly important, again, that just as we said with Coping House, and incredibly important to keep in contact with family members and friends, keep in contact with us and keep in contact with your medical providers so that the information is key and vital, so that information is freely spread throughout all of us so that we know how to best handle the situation on a day-to-day basis. And again, please keep yourself safe. Safety is the most important things in this time, and it's use your best judgment. If you guys have any questions past this live stream, reach out to us right here in the comments page. And please also make sure that in order to get in-service credit, put your name right here, right in the comments page so that we can see you guys. And we will be also uploading this video to YouTube, of which we will send you a link through ClearCare, like how we sent you a link to this. Same thing with YouTube. Please watch the video if you can. And then also comment on our YouTube page with your name to get that in-service credit. And then going forward for in-services, since we cannot do them in-house, unfortunately, we will be using this method of Facebook live streaming to get you guys the in-services that you need to keep yourself safe and hopefully informed in these times. All right, guys, that is everything. We hope this was helpful and informative, and we look forward to talking to you guys in the near future.
guys.
Bye, everybody.
Take care. Have a good weekend.